Good day, Mom. Today, I'll be performing the wound care. Without any further ado, first, let's review medical orders for dressing change procedure. You need to gather the equipment. So the first thing you have to observe that the sterile tray is not expired. Then, we have also the brand new normal saline. But I would have certainly put the date on it after I opened it. And the normal saline is good only for 24 hours period. And the next thing that also have here is non-sterile gloves. So we have here the non-sterile gloves. The next thing is to take the sterile drape and take out the edge of the sterile drape with your two fingers, then place it on a flat surface. Then after that one, so next step is to take materials in my sterile tray and put in the sterile drape. So, we need to put the sterile materials on the sterile drape. Then after that one, we also have here the dressing and solution, and I will be using the 4x4. So we have here then after that one, after reviewing medical change procedure, explain procedure to client and instruct client not to touch the wound area or sterile supplies and explain on what are you going to do. So, good evening, ma'am. So, ako day imong nursing assistant karon. Ako ngalan kay si Leah Jane Camanzo. So, karon atong pagabuhaton nimo is atong tambalan imong samad. Okay ra ba nimo?
Okay lang.
Okay. Kisa gali imong ngalan, ma'am?
April Jane man.
Okay. So, ato nang sugdan. Kay para magpunis mo ko galingon gihapon. So, after explaining to the patients on what are you going to do, close room or cubicle curtains and windows. Then after that one, position client comfortably and drape with bath blanket to expose only wound site. Then, place waste receptacle or the garbage within reach of your work area. So we have here the garbage. Then after placing the receptacle or the garbage on work area near of you, apply face mask and protective eyewear if required and wash hand thoroughly. So we need to put some face mask. Then, you can also use an alcohol which is 70%. Then after that one, put on clean disposable gloves and remove tape, bandage or ties. Remove tape, pull parallel to skin, pull toward dressing, remove remaining adhesive from skin with glove, hand carefully remove gauze dressing one layer at a time, taking care not to dislodge drains or tube. Keep soiled under surface away client's sight. So, put on clean disposable gloves and remove tape, bandage or ties. Remove tape, pull parallel to skin, pull toward dressing. Remove remaining adhesive from skin with glove. Remove gauze dressing one layer at a time, taking care not to dislodge drains or tube. Keep soiled under surface away client's sight. And throw it on a waste receptacle. If dressing sticks on a wet to dry dressing, do not moisten. If instead gently free dressing and alert client or position discomfort. Observe character and amount of drainage on dressing and appearance of the wound. Dispose of soil dressing in waste receptacle. Then after that one, remove gloves by pulling them inside and out. Then open sterile dressing tray or individual wrap sterile supplies placed on a bedside table, apply dressing. So now let's proceed to the dry dressing. So open bottle of solution if ordered and pour into sterile basin. So let's say that this is the bottle of the solution. Then we need to put in the sterile basin. So we have here the sterile basin. And after that one, apply sterile gloves again. So we have here the sterile gloves. So this is the sterile gloves. So we need to open it. So this is the right and the left of the cup of the sterile gloves. So the first thing we need to do, we need to put the dominant hand using the non-dominant hand. Use the 3 finger of your left hand. And adjust. Then after another one, so we need to use the 4 finger and insert the non-dominant hand. And adjust. Okay. After applying sterile gloves, let's proceed the next step. Inspect wound for appearance, drains or drainage and integrity. Avoid contact with contaminated material. Cleanse wound with solution. Use separate swab for each cleansing stroke. Cleanse the least contaminated area to most contaminated are used to dry goods to swab in same manner as in step 4x4 to dry ones. So let's say that this is the 4x4 dressing. So we're gonna use this to put on the basin with solution. And after that one, we need to clean the wands from least to contaminated area to most contaminated area. So let's start here. Then throw it on the waste receptacle and you need to get the another one. after cleaning, again, throw it to the waste receptacle. So the next step, we need to apply antiseptic ointment if ordered using same technique as for cleansing. So, after applying the ointment of the wounds, we need to apply dry sterile dressing to incision or wound. So, we need to use the dressing or the gauze into the patient's wound. Again, we need to waste receptacle. Then after that one, apply loose Weman gauze as contact layer. Cut 4x4 gauze flat to fit around drain if present. We cut gauze is also available. Apply second layer of gauze. Apply thicker Weman. So we need to apply the 4x4 gauze into the patient. Then now let's proceed to the wet-dry dressing. So in wet-dry dressing, pour prescribed solution into sterile basin and add fine mesh gauze. So we need to put some solution on the basin, and so we're going to put this on the basin with solution. Since I already have the sterile gloves, so now let's proceed the inspect one for color, character of drainage, type of suture and drains, cleans wound with prescribed antiseptic solution or normal saline. Clean from least to most contaminated area. So, again, let's clean from least contaminated area to most contaminated area. Again, throw it on the waste receptacle. And after that one, apply moist fine mesh gauze as a single layer directly into one surface. If wound is deep, gently pack it into wound with forceps until all wound surface are in contact with moist gauze. Apply dry sterile 4x4 gauze over wet gauze. Okay, so we need the forceps. And apply on the wound. And we need the 4x4 gauze. And we're going to put. And after that one, apply tape over dressing. So, remove gloves and dispose waste receptacle. So we need to remove the gloves. Then, remove mask and eyewear. Then, throw it on the waist receptacle. Then, assist client to comfortable position, dispose of supplies, and wash hand. So, let's position the patient in a comfortable. So, okay na ba ni mo na, ma'am?
Okay.
Then, wash hand or we're going to put the alcohol. Then, of course, don't forget to clean the area before leaving. And also the documentation. That could be all. Thank you.